Welcome back, everyone. Dr. Nasim Mastouri is with us today, a Lima Memorial nephrologist, talking a little bit about chronic kidney disease. Tell us a little bit, when you say chronic kidney disease, you get to that stage, what are we talking about? What situation were you in there?
Good morning, Jeff. Thank you for having me. Chronic kidney disease, or CKD, is a gradual loss of kidney function. The main function of your kidneys is to filter the blood and remove the waste and excess fluids. In certain situations, over time, like diabetes, high blood pressure, some autoimmune diseases, some congenital diseases, kidneys cannot filter the blood, and it's weakened the ability of the kidneys to remove waste and excess fluids. The two most common causes of kidney failure is diabetes and high blood pressure.
Is there, if we're having issues, and especially if we've gotten to that chronic stage, are there symptoms, some signs to look for?
Unfortunately, chronic kidney disease tends to be a silent disease. It means in earlier stages of kidney disease, there's no symptoms. As chronic kidney disease progresses, then yes, they may include some symptoms like extreme fatigue, weakness, generalized weakness, loss of appetite, nausea, vomiting, metallic taste, swelling in the legs or hands, and but it's end of the disease, end stage of disease.
It's kind of a scary question, but can kidney failure, can that happen to anyone at any time?
Unfortunately, yes, it can happen to anyone at any time. Sudden loss of the kidney function is called acute kidney failure, and the person's life is at risk. It needs immediate treatment, and but the good news is if we find underlying cause of the acute kidney failure, we can treat it. But meanwhile, patient may need dialysis.
Is there a reason for that, you think? Why you're seeing more patients come in with all different kinds?
Right. Those patients, unfortunately, those patients with acute kidney failure, they're hospitalized patients or they're critically ill in intensive care unit. There can be many reasons for that. It can be due to dehydration, it can be poisoning, it can be septic shock, infections. And but as I mentioned, if we find out the underlying cause of the problem, it is most likely it is reversible. But meantime, because they need immediate treatments and they're critically ill, they may need dialysis.
Let's talk about I know you guys have seen an increase in the number of patients. How do you meet that critical need? What does the hospital have to do to meet that?
The Lima Memorial Foundation is uniting our community to on an advanced journey to create a dedicated inpatient renal dialysis treatment center.
Okay, excellent. Dr. Mastouri, thank you so much. We appreciate your time.
Thank you.
You bet. Nice talking with you. We'll be back after this.